Welcome. We have waited so long to host you and welcome you today. And so I'm so excited to be here despite the crying that's happening.
Well, the message that we have today to convey is that we're very, very concerned about the increased incidence of anxiety in the adolescent population.
Changes in appetite, weight loss or gain. Typically with anxiety and depression, we can see quite a bit of weight loss.
Children are very, very different, and not every child presents the same way when they're having issues with anxiety and or depression.
Before COVID-19 and our pandemic, we had a significant mental health crisis. The pandemic has really just amplified every aspect of that crisis, especially with our children. Access to services, support services in the school buildings, and really just recognizing and supporting these students is a huge challenge.
In 2019, compared to early 2021, there was a 51% increase in the number of kids that we were seeing for suicidal actions.
Not only is this a bigger problem, but there's also a difference to the problem. There's something different about it coming off of this unprecedented time that we have been in related to COVID. It has, in some ways, fostered feelings of helplessness, and from that hopelessness.
We know that the impact of the isolation, the fear and uncertainty is something that they experienced during a time when their brains were developing and when they really didn't have the access to the communities and friends that they were accustomed to, and their lives are forever changed because of that.
They're also, just sort of trying to become into their own for adolescence. They're trying to figure out how to handle the normal challenges, and then they're faced with new ones. Many of us, growing up didn't have to deal with these type of things. So they're really just trying to mature, deal with like normal kid things. And now we're just putting so much more onto their shoulders and what they have to handle.
We need to change our kids' behavior. We need them to go to school. We need them to get an education. We need them to engage with their families. If we want them to do that, then we need to ask ourselves, when they can't, why can't they? And then use that bit of information to devise our plan for how we're going to approach the problem.
What we really hope our attendees leave with today is that sense of collaborative energy, that support of each other, the knowledge that for each kid that they're concerned about, that individual child they're thinking of as they sit here today and worry about what's happening for that child at home, that they can reach out to each other, reach out to other professionals in our region, know that the resources are being shared, that the connectivity is here so that as an individual provider and as a family member, you can find help and that you can find hope.